My name is Megan Bennett, and I chose to do my capstone project over the prevention and management of diabetes. I chose this project because I currently work in an observation unit at JPS. We have people come in for a number of reasons, usually unrelated to diabetes, and the amount of people that we send out of our unit with a diagnosis of diabetes is increasing almost every day. So, my rationale for choosing this project is to develop an implementation plan that helps to incorporate diabetic education in nurses' everyday practice. Diabetes associated healthcare costs in the United States is astronomical. We are one of the highest populations with diabetes, and the burden of this disease and its prevalence must be researched upon so we can enact great change. Healthy lifestyle changes can play a major role in the prevention of diabetes and the associated healthcare costs that come with diabetes and the complications. The major issue with delaying diabetic screening is the progression of the disease that it takes on the person's body in such a short amount of time. It has been estimated that around 50% of patients with diabetes have already developed some manifestations of cardiovascular disease. One of the primary challenges associated with managing this diabetes is the financial burden of the disease itself. Within research that I've read, it is said that healthy lifestyle changes could prevent 80% of the diabetes cases in the United States alone. It's a rapidly growing global problem with huge social, health, and economic consequences. Diabetes is associated with long-term damage and dysfunction of many different bodily organs, including the eyes, the kidneys, the heart. The United States is the third in the world, like I said, and type 2 diabetes starts when the body is resistant to insulin, and it does develop gradually with age, and sometimes the problems that come along with diabetes are seen before a diagnosis of diabetes even happens. So another reason why I chose this subject to do my project on, how can we as nurses educate the community on preventative measures so we don't see these problems anymore. We don't see the high cardiovascular problems, the high eye and kidney problems that come with diabetes. How can increased compliance with prevention and management of diabetes decrease the number of patients seen with this disease? Particularly in the U.S., there's a need to empower healthcare professionals and patients on diabetes care. I educate on diabetes every day. I have a lot of patients that have diabetes. I had the opportunity when doing this capstone project to sit in with our diabetic educator, listen to her, how she teaches these patients management of diabetes, how to decrease the comorbidities that come along with it. And it kind of got me to thinking. She talked a lot about managing the disease, how they can control their blood sugar, make great lifestyle changes, implement healthy diets. But I didn't really hear a lot of her saying what's going to happen if this patient does not comply with the diabetic regimen that she's given to them. The changes that happen in the body when their glucose is super high all the time, it takes over, it runs rampant. And I didn't really hear a lot of her telling the patients what's going to happen if I don't manage my diabetes. Yes, you're going to have complications, but what are those complications? I think it's real. Nurses, nurse practitioners, diabetes educators, we could all come together and we could have maybe like a toolkit of things to teach these patients that already do have diabetes. Working at JPS, we deal with a lot of the community. We are a community hospital, so our options into going into community is really easy for us. We have a lot of community nurses, and doing my research into JPS, into the community on preventative measures for diabetes, I didn't see a lot of that. There's preventative measures for heart disease and stuff like that, but not a lot on diabetes. So it really played a role into my capstone project also. We need to identify those at risk of developing the disease. Low income, impoverished areas, we see a lot of diabetes. It's really easy for these low income families to go and buy a $1 cheeseburger as opposed to a $6 salad. So how can we, as the population, come together to make the cost of healthy food lower? That's one way to prevent diabetes. Healthy lifestyle changes, dietary changes, it's all played into diabetes. Diabetes type 2 is 100% preventable. And it's really important that we let the population know that, let our patients know that. My literature review, I read more journal and peer-reviewed articles than I could stand. Just trying to figure out, there was so many on management of diabetes, but I really could not find very many on preventative measures. Okay, change your diet, change the way you eat, but how do we get this information to the public? That's the problem I had finding the most. There is one article, it was by Stephen Boyd, and he stated in his article, which was called Physical Inactivity, Obesity, and Type 2 Diabetes, an Evolutionary Perspective. He did state that recent findings about physical inactivity and health suggest new opportunities for addressing the diabetes epidemic. This was back in 2017, and the number of people in the United States diagnosed with diabetes since 2017 has increased astronomically. So we need to do more research onto preventing diagnosis of diabetes. The United States promotes physical inactivity that leads to a slew of healthcare issues. You know, we spend more time sitting on our phone at home watching TV than we do outside. There are research efforts that focus on the molecular biology of type 2 diabetes. However, it's challenging for the dedicated scientists to try to advance the biological understanding of the disease. We have to, as nurses, healthcare professionals, we have to be willing to implement change and to have our patients and our population implement that change also, which is proven to be a very huge task. The University of California did kind of develop a diabetes prevention initiative. Their basis for this was to lower the risk of incidence of type 2 diabetes among overweight adults with the pre-diabetic risk factors that they already had in place. If we could, every state could adopt, this evidence-based prevention program, then we may be able to reduce those health risks and improve the health outcomes of people with diabetes. Pre-diabetes is categorized as an A1C kind of between 5 and 6. Once you hit above that 6 level, you're at a more increased risk of being diagnosed with diabetes. I think it's really important to start in those numbers when we see the A1C kind of rising with those patients, to implement the preventative changes that we can, as nurses, educate our patients to take before it goes into full-blown diabetes. Healthcare systems, COVID has unfortunately kind of taken over everything. Before COVID was taken over the healthcare systems, we saw diabetic patients come in with diabetic complications. Like I stated earlier, eye disease, cardiac disease, kidney disease. I see a lot of people on my unit, a lot of patients on my unit come in with diabetic ulcers and end up with an amputation. Something as small as a splinter in their foot could lead to an amputation, in the instance that their diabetes isn't managed properly. The World Health Organization, they have some reports that they put out, and there's kind of like a risk score that combines the known risk factors, kind of like we see with pre-diabetes. And it's like a screening method that the World Health Organization uses that I think it's very important to implement with every single patient that we see. Community health clinics are a very strong preventative measure facility that we could use, that we could implement. Like I stated earlier, we don't have a lot of preventative measures for diabetes in the Tarrant County community where I researched. As far as my implementation goes, we have to always, when you have a goal, you have to have a measurable goal. Just like we set for our patients every single day that we care for them, we set a measurable goal. So in order to implement these, we have to set a measurable goal to be able to evaluate the effectiveness of our plan. So set a timeline. Just like the Healthy People 2020, the Healthy People 2021, that's kind of like a timeline of goals. We could implement diabetic education, decreasing those diabetes numbers that we see in the United States. There are risk factors with diabetes, genetic factors, demographics, lifestyle modifiable factors are the biggest risk factor that we see. Obesity, physical inactivity. Primary intervention is defined as the prevention of a disease by controlling these modifiable risk factors through prevention programs. So these lifestyle modifications that we can make is increasing physical activity, reducing calorie and fat content in food, as well as cessation programs for tobacco products. The diabetes prevention program is the largest primary prevention trial that was ever conducted in the United States. It did include around 3,000 obese and overweight men and women that have already developed an impaired glucose intolerance. They studied 4 groups. The modification group, they trained on healthy, low-calorie, low-fat diets and physical inactivity. And then the other groups, they kind of just monitored them. They watched them. They didn't really provide very many preventative measures for that. With the group that was educated on modifiable lifestyle modifications, it showed a 58% reduction in the risk factors and the chance that they would develop diabetes. So it just goes to show that with lifestyle modification, it plays a very major role in preventing diabetes as well as managing the disease. If somebody's already diagnosed with diabetes, if they've already let it get out of hand, we can educate them on the modifiable lifestyle changes that they can make in order to decrease the prevalence that they will develop further complications. Managing diabetes, a lot of us already know, so it's going to start with kind of an oral, depending on where they are in their diabetes already, metformin, glucophage, everything of that nature. Metformin is usually the prescribed drug starting at first if their A1C is less than 10% or their fasting glucose is less than 300. Anything outside of or above these ranges, their chance of needing to be on insulin increases. Now, insulin compliance has been proven to be very poor. Education surrounding insulin, its use, what's going to happen if you take too much or if you don't take enough, needs to be kind of educated on more. Insulin is costly. Insurance companies really only cover a fraction of the cost of insulin, so those patients that we see that do need to be on insulin sometimes can't afford it. It goes back again to the factors that play into the development of diabetes. They're low income, they're in their poor, impoverished communities that can't afford the healthy food, the lifestyle modifications, so the cost of insulin is really, really tough on them. It has been seen and said that a 1% decrease in the A1C will result in a 21% drop in complications rate. It decreases mortality and morbidity rates in diabetic patients. So if we can teach and educate on the preventative measures to bring down that A1C, to bring down those glucose rates, then we could see a lot less complications come from the disease, a lot less hospitalized patients with cardiac problems and eye problems and kidney problems and diabetic ulcers. Diabetes is said to kind of be a multifaceted disease, so we have to kind of personalize the management of disease to the patient. So the most critical purposes of the program are to assess and improve quality and determine effectiveness. Determine the effectiveness of our teaching, just like we do with our patients every day. How does the teaching ways help work for them? What's the best way to teach this patient? And we can assess the effectiveness of prevention and management programs. We must examine prior diabetes cases and relevance to any decrease in the patient's diagnosis. It could take years to measure, but it's something that we could do as a whole. Like I said, I was able to sit in with our diabetic educator. She does play a very vital role in supporting our diabetics and providing guidance and management techniques. In summary, diabetes is one of the major clinical problems that we see worldwide. Early detection as well as risk assessment methods will help identify earlier the possible onset of the disease. We must teach again on lifestyle modifications, dietary modifications to the general public in order to decrease the onset of diabetes. Diabetes is one of the most common comorbidities worldwide, and focusing on lifestyle interventions, connections between comorbidities such as obesity, lifestyle, and diet, prevention can be achieved. Thank you.